It's really wonderful to, um, to see everybody here today. So as we get started, should be a really, really real great show today. We're also in celebration of the 90th birthday of Miss Juanita Kurosaki, also known as Mom. She is a sweetheart. I've known her for many years now, and her beautiful family is just extraordinary. And I feel weird even saying it like that. That's my family. These are people that I've known for, oh man, just over 30 something years now.
Mhm.
So that's family. Anyway, I'm going to be saying her name throughout this entire cast because she's brilliant and beautiful. 90 years old. This is really, really incredible. So, yeah, we're going to really have a great time here today. I want to start off with, I'll introduce those of you who haven't met the wonderful Carolyn is here with us today. Carolyn, good morning to you.
Good morning. Good morning. Happy Halloween weekend. Woo!
I'm scared.
I've got my Penny from Good Times uh, costume going with the hairstyle, kind of ish, a little bit. And
You look good. Whatever.
yeah,
Yeah. So
how have you been? How have you been, Dr. Zari?
really wonderful, really wonderful. We got Chinese in Dukui. And good morning to you and everyone. And we have the wonderful Cheryl Lee Gento Smart. It's like gentle, smart. Got the
Just
dash going on. Yes, and a very good morning to Eric if he's around. Hey, Dr. James is in the house. It's great to see you, Dr. James. Man, we really miss you, man. I know you've been busy, so good morning to you. It's so great to see you. We're going to really have a wonderful time. I want to thank everybody as we do at the beginning. To for you to take your time and share it with us. We have Ad Warrior. What's up, man? Hey, now it's good to see you. Sky Aim Productions always great to see that support. Sky
yes,
Aim in the house. Oh man, it's wonderful. I want to start this off by reading Nelson Mandela's 1994 inaugural speech. It goes like this: Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Actually, who are you not to be? Your playing small does not serve the world. There is nothing enlightening about shrinking so that other people won't feel insecure around you. We were born to make manifest the glory of the God that is within us. It is not just in some of us, it is in everyone. And as we let our light shine, we unconsciously give other people permission to do the same. We are liberated from our own fear. Our presence automatically liberates others. Nelson Mandela, 1994 inaugural speech. I
right.
just had to, I know you've heard that before, probably, but it's a really wonderful thing. The stuff that when we're talking about health, when we're talking about fitness and all that, these are some of the things are that really makes it make sense, when we know more about ourselves, you
Right.
know, and this is so important. We can talk about nutrition, health, medicine, science. We can talk about that for a long time. and every time, but until we really know about ourselves and get a better relationship with ourselves, it doesn't make any difference. So we're going to talk about some good stuff today, and in talking about these different, the mysterious, and the strange, and some of the unique illnesses. Oh yeah, the Halloween, Halloween fingers, everyone.
This is our Halloween theme: weird and mysterious. Woo!
Weird and mysterious, right? Yeah, that's so we're going to talk about that. And as we get into it, what I want to do is to get more people in as we ease ourselves into this. We are on Instagram. Along with Instagram, we are definitely on other, like what else are we are?
We are on your Facebook page, Farid Zarif, on YouTube, Dr. Farid Zarif YouTube
All
page,
right.
and on Instagram, you are on I am Dr. Farid Zarif. And I sent you a request as well on Instagram.
Okay.
So we'll see how that works out with the delay, but I sent it to you.
Okay, let me see here. I think I just sent it back to Kate.
Okay, I see it here. It's connecting. There we
All
go.
right. There you go. Uh-oh. We got a little echo there. Should I turn it off? How do we do that?
Oh, I know.
There we go.
Does that help?
Yes, that worked. All right.
I got the technical skills on deck.
All right. Let's do this.
All right.
I want to share information that covers how rare diseases impact our most underserved communities, and that's the ones that most of us came up in. And I want to also talk about how health and equity and the inclusion of disparities shape the diagnostic treatment and curative process for the diverse patients living with rare diseases. Now, most people probably haven't even discussed rare diseases before, but I think by the time we finish with this, we'll get a better understanding of what these diseases are, underscoring the barriers to care shown in the preventable hospitalization information, the systemic discrimination, and unconscious bias in the medical space can contribute to an even more arduous diagnostic odyssey for diverse rare disease patients. Some of the barriers to the treatment exist for many underserved communities, and the individuals preventing the equitable access to medications or procedures due to pre-existing bias of Black or the lack of access. And a lot of us go through this, especially the worrisome. It's worrisome from the rare disease patients like we have in our community, sickle cell anemia, for instance, which has a high prevalence in the Black community. And these brothers and sisters, they face the pain crises as a symptom. I mean, this is something. It's just like when one of us, Black person, gets shot or a baby gets loses a life. You know, we're affected by that. We continue going on, but we're affected just like anybody else that loves their people. After this presentation today, what our objective is to get people to be more aware of the things that are available to them, another way to think, to not to continue to push the same narrative that we've been hearing for a lifetime, it seems like. Due to bias, patients reporting pain may be taken less serious due to their gender or due to their age. And we find that a lot of people that are over 55, let's say, are treated as if, you know, they're not deserving of getting this kind of treatment to that will fight against the rare diseases and or the treatment that they would need just to keep their regular health up. I have been, as far as patients that I have the honor to serve, I definitely point them into the direction of the care and being proactive with the care, making sure that they are getting examinations so that they can um, really have a better um, feeling toward doctors, you know, as a matter of fact, you know, a more confidence, getting rid of, I'm not letting a doctor touch me, all of those kind of things that there's, we understand that there's definitely basis for it, but we want to enlighten you so that you may be also empowered. Now, after controlling for age, race, triage class, and the pain score, women were still 13 to 25% less likely than men to receive opioid medications. This was according to the article in Academic Emergency Medicine Journal. There was no gender difference in the receipt of the non-opioid analgesic. Uh, with a median time of 65 minutes versus 45 minutes, difference 16 with a difference of 16 minutes, women had to wait longer to receive their medicine than men. All this kind of stuff, you might like, what in the world? You know what? This has no place in our hospitals, but these are some of kind of the things that go on. Some of the community health risks, the minority populations with uh, uh, and without rare diseases have much higher rates of high blood pressure, diabetes, obesity, and heart disease is common. All of these are common comorbidities. And comorbidities are these not only the disease that you may, like, for instance, if you're suffering from diabetes, you may also have some kind of heart disease, or you may also have high blood pressure. Those are the comorbidities. And these conditions, when combined with disparities in access to healthcare, greatly affect the health status of the underserved rare disease patients. Now, understanding and knowing the common community health risk is imperative for underserved community members in reducing unnecessary health risk and being empowered in their health discussions. Many of us feel that we are speaking all alone because there are so many people that don't take time to back you up and to support you during the time that you are experiencing these diseases or experiencing different ailments of the disease. Now, when we talk about the rare diseases, our certain rare diseases, they may also be tied to certain racial or ethnic groups, and with either heightening of the prevalence of the greater rates of mortality. and I'll just go over a couple of these different rare diseases that may, in effect, be something that you've heard before, something that you're suffering from. Sickle cell disorder, uh, thalassemia, hair cell leukemia, vestibular schwannoma, hepatocellular carcinoma, osteosarcoma, amyloidosis, Alpert's syndrome, Beckett syndrome, factor 12 deficiency, gastrointestinal stromal tumors, hyperemesis gravidarum, IgA neuropathy, Kawasaki disease, systemic scleroderma, that is, and ocular cutaneous albinus 2, and Hermansky-Pudlak syndrome. And there's definitely, I won't pretend like that I've heard of all of these. These are some that are very rare, and it's like, what the heck is this? So these are some of the diseases, and I know the very one I listed, the sickle cell disease, and that's a disease where, you know, the cells, the blood cells in this mostly shown in Black, or the Black culture, these cells, they change their form and they're difficult to move throughout the body. And this is, there's a sickle cell trait and there's a sickle cell disease. We won't go over that because we'll be here all day, but keep that in mind. You can play it back and you can hear things that, like, you know, the hepatocellular sarcoma. I'm just wrestling with the word. This is really something that that we can, you know, look into. And then you have the osteosarcoma. You know, these are things that need to get your backup. You need to go and research it and just find out more about it. And just like me fumbling over the words and stuff is because I'm not familiar with some of the things, and I don't pretend like I know everything about anything, but I know that these are rare. They're so rare that, you know, I'm supposed to, like, what the thalassemia. I've never heard of that before. You know, and that's something that there are diseases that we're not aware of. And I know that, you know, it's like, no, you're supposed to know everything. Nobody knows everything about anything. So I'm going to bring the fire. But I just wanted you to know that I am aware that I don't know everything. So, some people, man, I'm telling you, it's a trip when you put yourself out here. It's like, okay, you better be ready for the other side of that. Now, I just want to go over a couple of these deadly diseases. And well, I just say it like this: there's several deadly diseases strike Black Americans or African Americans harder and more often than they do white Americans. Now, fighting back means the genetic research, finding out more about your genetic research. It means changing the system for testing new drugs. It means improving health education. It means overcoming disparities in healthcare. And it means investments targeted to the health of Black Americans. And the evidence so far indicates that these investments will pay health dividends, not just for racial minorities, but for everyone. You see, we spend more money on drugs, medications. We have our medical bill is bigger than any expense that we have in America. And that's more than even spending all the money on the tanks and all the $1 billion planes and all that stuff that it seems like, wow, all our money goes to protecting America. Well, our largest bill to this day is the medications and the treatment for illness. So hospitalizations, urgent care, emergency, so forth. Now, diabetes is 60% more common in Black Americans than in white Americans. Blacks are up to 2.5 times more likely to suffer a limb amputation and up to 5.6 times more likely to suffer kidney disease than other people with diabetes. Get that? These are facts. This is science. This is not some high school homework. And I just saw this in some kind of it appeals, I guess, to just the class. This is something that we want you to keep in mind, because these are some of the things that affect us and our families. 60% more common in Black Americans than in white Americans. That's over, of course, that's over 50%. And that's definitely something that we should understand. Our amputations, when we get our legs, like when a person gets his foot removed, or there might be the leg all the way up to the knee, or from the knee down, those amputations again are 5.6 times more likely, or that's 2.5 times more likely to suffer from a limb being amputated. And we in America, statistically, most of our amputations are connected with diabetes and other blood disorders, and especially type 2 diabetes, that we are having to have this type of treatment. African Americans are 3 times more likely to die from asthma than than white Americans. Now, this isn't a racial thing. It's just showing you why is that? Because we actually physiologically we're the same. Physically, most of us are the same. So why are we as Black people dying faster, and why do we have the most when it comes to disease? Why are we dealing with these diseases in our community? And other communities that they aren't dealing with it at all? There's also sarcoidosis and other lungs, that's other lung scarring, but there's death from lung scarring, and not sarcoidosis. You've probably heard of that before. A famous comedian, I won't mention his name, but there's a famous comedian that died from sarcoidosis. And sarcoidosis are 16 times more common among Blacks than among whites. The disease recently killed a NFL player also, and that was really sad. And I'm sad to say that was, I won't say his name because I'm not doing this for fame. I'm doing this for education, and I don't want to do that, especially without the permission of his family, and I don't want to trigger anybody. Despite the lower tobacco exposure, Black men are 50% more likely than white men to get lung cancer. That's one of the things. If you have children or your spouse or friends, that people that smoking Smoking by itself, smoking is that tobacco that by itself is definitely a detriment, is detrimental to anybody that does it. If you ever see a vascular unit or like a vein, and if you can see in the center of it, which is called the lumen, you'll notice that the lumen, after a person takes that draw in and the smoke is in their body, their veins actually they get smaller. You see, and they constrict. They get smaller and they get tighter, and they can cause that every time after time doing that, they can cause a lot of other problems in the body. So yeah, I know it's cool for people to be, to smoke weed. I know it's cool for people to smoke cigarettes, but that's all it is. It's just something that is a trend. A lot of people, some people do it because they feel that they're more acceptable, or they like it because they're more unique than another person, or whatever their reasons are. But take the tobacco away from your mouth, and that's including also smoking marijuana. And I know that's hard for some people to hear because they're like, marijuana is here to stay. Well, so is disease if we don't do anything about it. Strokes kill 4 times more 35 to 54-year-old Black Americans than white Americans. Strokes just takes us out, because we're constantly dealing with these diseases that involve stroke, such as diabetes or type 2 diabetes. We don't get enough rest. We stress ourselves out. We, from everything with dealing with issues of our family, or the stress of a job, or stress of not eating the right foods, being in these food deserts. All of these things are cumulative and can be very, very detrimental to African Americans. African Americans develop high blood pressure earlier in life and with much higher blood pressure levels than whites. Nearly 42% of Black men and more than 45% of Black women aged 20 years and older have high blood pressure. And that in itself is something that we constantly ask you to take your blood pressure, so that you'll get a good idea of where your pressure is. We're looking for lower than 120 over 80, 120 or over 80 or less. You see, and that's really important. And if you're still eating the foods that cause your blood pressure, and some of you may not even know because you're not taking it on a regular basis, but take your blood pressure on a regular basis. Don't wait until you get an annual exam, and then you don't know what's been going on in the whole year. So make sure that you give attention to that. When it comes to cancer treatment is equally successful for all races. Yet, Black men have a 40% higher cancer death rate than white men. African American women have a 20% higher cancer rate than white women. So with that, again, as I said earlier, physiologically we're the same, physically we're the same. So there are some things that may vary cultural, but they're very rare. And that's what we'll be talking about today. Our genes definitely play a part of all of this. So does the environment which people live in, our socio-economical status, and yes, racism too. So these are some of the things that we want to constantly keep in mind when we're talking about some of the different diseases that we'll be talking about today. All humans, I have to make sure that I am repeating this, that all humans have the same physiology and are vulnerable to the same illnesses and respond to the same medicines. It's just like you don't give a black person Librium and you give a white person Librium, and you get two different white and black reactions. It's the same thing. And I know that's hard to believe, but if you believe in that, that's because you have been programmed to believe that there is a difference in the humanity of a black person and a white person. It just doesn't exist. Those things, that's all of that is just very bad as disinformation. All humans, I'll say it again, have the same physiology and are vulnerable to the same illnesses and respond to the same medicines. Now, naturally, diseases and responses to treatment do vary from person to person, but there are unique issues that affect Black Americans. Now, we must recognize that there are some arbitrary issues that are present in the way that we practice medicine and dole out our health care. It forces us to think very carefully about the very volatile issue of race and what race means. But at the end of the day, all of us acknowledge that the race is very that race is a very poor physiological construct. Race is a placeholder for something else. There's something that is less likely to be genetic. So when we compare like this human with that human, those things just aren't true. And that's why medicine is global. You can send doctors to anywhere on the planet to deal with different diseases, and they can take the same let's call it their medicine kit or toolkit anywhere, and the apparatus will work wherever, and the same medications will work in all places of the planet. So yeah, we are unique, but we're not so unique that we treat a Black man different than you would a white man, a Black woman differently than you would a white woman. So let's keep that in mind. I'm going to stop just to say hello to some folks out here. I see a lot of people is here. Ad Warrior for Christ, AD Warrior for Christ is here. Thank you for being here. Hall Matt is in the house. I think is Mahad, and we have Sherry is here. And thank you very much for being here. If you have any questions as we go along, or if anybody wants to come up, you just simply send us a request and we'll bring you on up, and we'd love to have you. Let me see here. Yeah, Dr. James is in the house, and we have Lily and we have Shirley in the house. And wonderful, incredible nurse that she is. Maybe we'll get her a chance to get off. Maybe she can get off the floor. She's probably real busy, very, very busy, but great, knowledgeable woman, incredible. Hello, everyone. I am Dr. Farid Zarif, and I am the nutritionist. And I use that name. People ask me, why do I just call myself the nutritionist when I know this and I know that? I want you to underestimate me more than overestimate me when it comes to all the issues that we talked about. So I don't mind that. Now I love the skin I'm in, so I'm not looking for any reinforcement that's outside of the reinforcement that I have for myself. So when I do get those compliments and helping you pull your health together, this is what's most important to me. So thank you so much. We have Watch What the Health is just namaste. Has just joined us, and I'm really glad, happy to hear you, happy to see you. I'm like, some of us we don't see, but I'm just saying that I'm really happy to see each and one of you. Thank you so much. Yeah, and read the Be Vegan for Gratefulness, Love, Health, and Success. Animals are sentient beings and feel pain. Actions speak louder than words. Very good. Yeah. So check that out. That's Watch What the Health. I wanted to also let you all know that I do have a site. It is drzarif.com. And I won't go to it now because I don't want to spoil the flow that I'm in right now. But check me out, drzarif.com. There are some combinations there that are known, some of the formulas that are known to help people with those certain maladies, and it may be something there for you. drzarif.com. Want to continue to push that. We got some great, I'm going to surprise you with we have some merch that we'll have coming out real soon, and we want to get it under your Christmas tree before Christmas. So we're having fun. Remember, I forgot the comedian's name, but he stops every once in a while and he said, "We're having fun. We're having a good time." You know, uh, so we are. Let's go ahead and keep on going here when it comes to. Well, let me stop for a minute because I'd like to have Carolyn. Why don't you go ahead and reset the room? This is a good time. Thanks.
Absolutely. I remember to unmute this time. Thank you so much. And thank you to everyone that's joined us today in the Mind of Nature with Dr. Zarif, the nutritionist. The title today is Weird and Mysterious Diseases. Thank you all so much for joining us. Please share the live. When you share, it brings more people in so they can be a part of the conversation. And also, please like as well. When you like, it also boosts the live, and it takes it out, and we can get more people to be a part of the conversation as well. So, Dr. Zari, just wonderful information. I think it's strange how you say that. Of course, we're not different, but diseases tend to um, affect the Black community more than any other community, really. So I think that can be mysterious in its own way. Just to you think
Yeah.
that, yeah, you think that has a lot to do, and this is just me, just by the way we may eat. There's um, a way that we eat that others don't eat. So the way or diseases that come to us may affect us in a different way, or in the body in a different way. Would you say?
Well, I think that it forces us to think very carefully about the very volatile issue of race itself and what race means. I think that, it really helps to emphasize on the difference between, or not just so much the people, but it's the way that we think or we've been taught to think about ourselves. Now, there are some racial differences that are more have more nuances, but the important thing is that we take into account our socioeconomical effects, our genetic effects, and the political issues that plague us in a way, constantly, because this is something that we don't account for. Even myself as a Black man, I don't think just like most of the other cultures, because when I drive, I got to think about, like my stomach still rolls when, I pass or police come up, on my bumper. Because I've been pulled over, it's like, oh, damn, what now? That kind of thing. So that's another part of it. Then there's another part where even, how Black people feel around Black people. There's been many times that I've been around other brothers and sisters, but they don't feel the same that I feel. They think of me differently. They have that same skin, but they think differently. So that's a problem. Like, do I, how vulnerable we are, exposed we are to some people that just don't like to look in the mirror. You know, we look just like each other, and that's who they want to take out. And that right doesn't make any sense to me. But I do know that we are definitely, when it comes to taking care of ourselves, if we don't make a change, that we'll continue to do the same things over and over, and then generation after generation will have to suffer from the delay of us not speaking up and not sharing and not doing something about our health. We still got we still have brothers and sisters that are um, suffering from disease now because they won't put the plate to the side. They won't shrink the size of their platter. They won't stop eating large amounts. 8 slices of bread for in as they're eating dinner, or maybe those people that have like 8 eggs and toast and jelly in the middle of the day. Some people that are drinking soda and chips, not for a snack, but for a meal. And they do this on a daily basis. You see these bags of chips and Cheetos and all that stuff are huge bags. And people actually open that, one person. I'm not talking about like you're at a party and you're sharing, but one person. And this is complicated with other diseases like depression, like anxiety, and other personality disorders. So stop, look at yourself. Think about all the things that you can do. Think about why you're here. Do you know that you do have a purpose? Do you know that you have a meaning? Do you know how your body works? And that's why we're here, so that we can mentor those that don't know, and those who want to know, and those who continue to practice the good, I guess, educational habits, and that's to read, and that's to listen to educational programs. I am so thrilled that leisure, what is that?
Earn your
Um,
leisure.
yeah,
It's exactly.
Earn Your Leisure is the two beautiful brothers that take time to educate especially the Black community about finances. That
Oh,
is so incredible to me. I absolutely love it. And that is why I am here also, just like those brothers. And it's like there are other shows, not many yet, but there are other shows, and they're bringing on people that are out there doing wonderful things. I didn't even know so many Black people had businesses. I'm like, wow, really? And I'm not talking about as an employee. I'm talking about they're calling the shots.
right.
The
The
ones that,
CEOs,
yeah,
right.
they built it up from the ground up, and they're still working. But none of us can. Before I go on, you want to say something about that, Carolyn?
Well, no, I agree with what you're saying as far as that. I watched a few clips of the Invest Fest that they had a couple of months ago, and they just had great panels. They had, just great conversations on, different people in the Black community doing great things with their businesses, and they're just helping with finance. That was a finance um, fest, or seminar, I guess you can say, but it was a huge seminar. But the room was just filled with Black people wanting knowledge about finances. You don't see that much. So, I agree with you. I just love what they're doing over there at Earn
And
Your Leisure. Yes.
and to your point, as far as the attendance, I think last year the attendance was like 3,000 people that came to the
Invest Fest.
Invest Fest, and now this year 15,000, from 3,000 to 15,000.
Yeah.
And many of these people are they're paying. I mean, they're paying to come to see it. They're supporting it. They're not just they're not just talking. They're doing something about it, and that's what is very, very important that we do something about it. We just don't talk and talk. We've been talking for centuries. We've been talking, and many of us are. If we don't do anything about it, we're going to be in the same place that we were years ago. So your family, those little babies running around, those little cute sweethearts that you got in your family, you got grandchildren, you have children, they have children. Look, they are not, disposal units. And I've been around people that they take those children and they're giving them all this junk. Here, eat it. Wait a minute. What happens is that we become the very foods that we eat becomes the tissue, the cells, the body that we are. So if you're feeding your child some foods that lack in nutrients, then, your child suffers from that. And just because you can't see it working doesn't mean that it isn't. It's working against that child. So we can do another show on that, because I do see a lot of abuse when it comes to children and what mothers and fathers allow those children to eat. And cereal is not one. Cold cereal and other things. I'm going to stop here because I'll go into it. I went too far. And before you know it, we talking about cereal.
No Frosty Flakes. No.
Yeah, all of that crap.
Yeah.
And then what happens is that we feed our children and we eat ourselves so long these like cold cereals, Cheerios, all this stuff. And then 25 years down the line, when you see type 2 diabetes showing up, if a person is diagnosed with type 2 diabetes, and it's like, I don't know how we didn't have that, or whatever the comment may be. But if you are eating in a way that is weakening your body and doesn't give you strength, what do you expect after 25, 30 years of eating that? You see? I have people that I've gone to school with, and people that I've taught that are younger than me, and people that have children, and some people that have great grandchildren now. And some of them haven't changed in all of those years, and they suffer. Each one of them suffer. It might be a rare case, but each one of them have something that they're suffering from. I don't think you can go all the way through life without some kind of disease or something, and you're lucky if you do. But most people, even with the all the different tools that we have to help ourselves, we're still not using them. So you need to use like your blood pressure cuff. You need to use a glucose monitor. You need to use a temperature, a thermostat. You need to use all of these things that help us to keep a tab on our balance. This isn't just for, I'm sick, now you take it. It's about not allowing yourself to get sick in the first place. And this is something that we go over and over again. But I got to say it, if it's going to take 1,000,000 times, that's exactly what I'm going to do. I want to share with you a report. Now, I took one that's a little older because I wanted to show you back then is worse today. And back in 2005, a report from the American Lung Association shows that Black Americans suffer far more lung disease than white Americans do. Again, some of us have white people in our family, and I ain't here to talk about white folks because that's not right now. My issue is with these Black folks. And so this isn't, don't even attempt to say, oh, this is racial. He talking about, no, I'm not talking about that, so let's just keep that straight. But what I did want to share with you are the findings that Black Americans have more asthma than any racial or ethnic group in America. So it is important for us to finding out more about researching asthma. But we know, and we've been told these three main principles is that you eat the nutrients that you are eating, have a nutrient dense food, making sure that you get ample sleep. And that's sleep, not just taking a nap. Sleep is really important because this is where your body actually helps to repair your body. This is where we grow muscle. This is where we heal. And the other thing that's very important is physical activity. These are things that are ongoing, everybody. It's not something that you do and you do it for a little while and then you go and have a rib sandwich and then you out. Do they have rib sandwiches? I don't know. But you know,
I'm sure they do.
man, you know what I mean? It's just really, these are things that it's great. You got a whole life ahead of you. And if you take that life and you throw it to the side because you neglect it and you don't use it. Look, if you're a person that have any type of intelligence, you know that having the opportunity to travel the world, to help other people, to amass a large amount of money. I don't know what your goal is, but I know you can't do it if you're not healthy. And not even with all those brothers that's out there that's doing this great work. I challenge you to continue to eat healthfully, not to be all of the, we have some, and we've had these leaders that they'll say smart stuff, but they're coming on with a joint in the hand and they talking about some whatever they're talking about. And then you have those that are pushing their products. So they here, drink this. There's a show that is based off of drinking. This is just a lot of guys. It's a great entertainment, but it's, like one of the messages is drinking, having fun, drinking alcohol. And we continue to have those kind of habits. We're not in the place to even get that cool, throw up our feet and just throw some chips down our throat and just think it's going to be all right. Because here are, and I've been reading you some of the proof for some of the predispositions that Black people have. So I was talking about sarcoidosis, and sarcoidosis is the scarring of your lungs. You know there are other lung diseases, but sarcoidosis is really scary. It's 16 times deadlier in Blacks than in the whites. And when it comes to Black American children, I love children, and we're going to do a special for them. But the Black children, African American children, are 3 times as likely as white American children to have sleep apnea. Now, sleep apnea is just like a series of suffocations. You go to sleep and you don't breathe smoothly. And if you know what I'm talking about, if you have somebody with sleep apnea in your family, I'm not just talking about snoring, but I'm talking about these little mini suffocations that one has all through the night. And this is in children. Then you have the Black American babies die of sudden infant death. That sudden infant death syndrome is called SIDS. You probably heard of it, SIDS. This is really, really horrible because you're talking about a baby now, someone that's sometimes less than 1 year old, because it's sudden infant death. And they're 2.5 times as often as white American babies. So Black babies are dying of this sudden infant death syndrome 2 times more likely than white American babies. The reason that I'm comparing white with Black is because of the disparities that we face on a regular basis. It's nothing new. So those Black people that are tripping out that I'm saying anything that I'm saying versus white people, just why don't you just go lay down somewhere and to get a little rest, come on back when you feel better. Black African American men are 50% more likely to get lung cancer than white American men. Now, this is off the top. This isn't like we just have a propensity for a lung cancer, and it's 50% more than it would be with in white American men. Black Americans are half as likely to get the flu or pneumonia vaccinations than whites. Again, that goes back to disparities in some of the things and how we've been treated, and some of the information that we've collected over the years in how we've been treated just because you're black. And it sounds very simplistic, but that is what many of us go through when you walk into these different urgent care centers. Sometimes you don't have to worry about that. And I have to say that it's rare. It's not running rampantly, but it does exist. And the avoiding being involved with these doctors and these teams. Of course, that's the way people definitely want to avoid that. I know I do, and you don't want to send any of your loved ones to people that are not treating people equally. There are a couple of reasons. I'm just asking myself why, and I would say there are a couple of reasons why. One is that 71% of African Americans versus 50, and this is African Americans, 71% of African Americans versus 58% of white Americans live in communities that violate federal air pollution standards. Now, when we look at African Americans in terms of demographic or the demographic, or in terms of the demographic distribution, they are more likely to be located near or right next to transportation corridors and to places where the air is drawn. So that would be around a foundry, or it'd be around somewhere that a factory and so forth. And this is where we have the poor communities are like that today. And some people that had those houses closed down, they're reopening them and refurbishing them because of the inventory of homes available. Got to be really, really careful. There's places too that are, where they have the oil, they have the oil pumps, and there is a process. I want you to look this up, called fracking. Some of you know about it, some of you don't. But the poor quality of that water in that community, and it's only in these communities that are populated mostly by Black people. Now with gentrification, you have more white people moving into those same areas. Now, but what they're doing is they're also adding a water softener and filtration units to help with the water situation because of the high cost of living today. Now, another reason is that a higher percentage of Black Americans than white Americans live close to toxic waste dumps and to the factories that produce this waste. So not only do we live closer to these waste dumps, but we also live close to the factory that's actually making the waste that goes to the waste dumps. So all of this stuff is something that we want you to keep in mind. Genetic differences may also play a role. For example, it's clear that cigarette smoking causes lung disease. We just said that. Cigarette smoking is declining faster among Blacks than most whites, but Blacks still die from lung disease more frequently than white Americans. This could be due to healthcare disparities. That's what we're talking about now. Blacks may get diagnosed later when diseases are harder to treat. In other words, not coming in. I was just listening to the Earn Your Leisure, and they had a guest on that show that actually talked about the height of gonorrhea and chlamydia, and that they have a business now. These trucks, a medical truck or a medical shuttle, that go around and they give people free treatment. They'll have a free testing kit, and they can actually test themselves. They can use the test kit, and then they mail it in, and they'll get their results, and they'll also supply the medication for that result. Well, this is really important that we use the different things that are available to us in our communities, that we use the knowledge that we have, so that we don't have to keep repeating some of the things that we have been suffering from over the years. It's taking time to choose exactly what you need to do in order to get away from some of these things, like putting off your examination. And putting off your examination, like, at the top of the year, here it comes again. If you haven't done it, set a time to do it. If you don't do it, what you're doing is you have a goal. No, but the goal is more like a dream, because you don't have a start date. You don't have a deadline. You didn't write it. You didn't put it in the calendar. You didn't make a phone call. If you're just saying things like, yeah, I'm going to take care of that. I got to take care of that, man. It's been hurting here for a while. And if you think that's just gas, people that are not taking their lives seriously. The environment is involved, and there's potential genetic susceptibility. But we also have to talk about the fact that African Americans' social and economic status lacks behind that of Caucasians, and low socioeconomic status is linked to more disease. You got to keep that in mind, because socioeconomical isn't just means that people don't have enough money compared to other people's money. It's talking about the monies, we not having enough money to have the kind of services that would keep us from being to threaten our lives. And this is so important. It is not a simple question to access the healthcare itself, but access the specialists. Even with HMOs, blacks get specialist referrals less than whites do. So if you have a person that you're working with as your doctor or as your primary care physician, whomever you're working with, make sure you ask for specialists. And that's why here on The Mind of Nature, we talk about those specialists. For your stomach, a gastroenterologist, women with the OBGYNs, those are specialists, or people that are specialists like an eye doctor, ophthalmologist, or if you are dealing with anybody that in endocrinologists, or these different specialties are the best people for you. This is why it's important. Like, you might see dentist, but if it just says dentist, okay, what's the specialty? What do they specialize in? If it says general practitioner, you should know all of that. So write this stuff down so that you will keep it in mind. I wonder if minority populations put as much pressure on their doctors to get specialty referrals. I keep that in mind constantly, because some people said, the doctor told me, the doctor. If you're dealing with the doctor, you should know that doctor's name. That's another human you're putting your life in their hands. So you should know. I saw Dr. Jackson. I saw Dr. Thompson. I saw Dr. Watchtower. I saw Dr. Watch Dominion. I saw Dr. Whatever the doctor's name. You should know the names of your doctors, and you should know the names of your nurses and your practitioners. It might be a LPN, licensed practical nurse, or it might be a RN, or it might be whatever. Whomever is working with you, you are working with them with yourself, and you should take time to find out more about them. Stroke, we're being killed by stroke more than in any other culture. Black people, black men and women. So let's look at that for a minute. Heart disease and stroke disproportionately affect African Americans. And why? Because what sets the stage, if we will, for a more aggressive and higher incidence of heart disease in African Americans is a very high incidence of high blood pressure. You say, how is this connected? Well, this predisposes African Americans to more heart disease, kidney disease, and stroke. And heart failure, an African American is much more likely to get there with the absence of previous heart disease. So we're getting heart disease. These numbers are going up because of our previous bouts with heart disease, myocardial infarctions. We have different types of ischemia, and we are suffering from that because we're not going to get those checkups. We're not checking out our doctor, letting them give us those examinations. I'm so happy when I hear people are now checking their numbers. It's going to take a time to do what we're here to do because we have so many people that are turned off to themselves. You have to turn yourself on to yourself, and you have to be about knowing what you are, your limitations, your strengths, your weaknesses, you see? So all of those things are super important in order to keep yourself checked. And just because you're a professional doesn't make you exempt from the pain, exempt from the disease. You are human. And believe me, well, I know personally people that are professionals and in the health field and medicine, in education, and in any other specialty or genre of education that you want to name, that they do not eat like they know that who they are or what they are. But let's take a closer look at the data that shows that race tends to be a marker for complicated high blood pressure treatment. Data suggests that all therapies do equally well, but patients at higher risk need more intensive care. So patients at higher risk really need to have a plan, a schematic, you need to have, don't say hope, because hope does not come with a strategy, but you need a strategy that will help you move and do things that will maintain your health. We're going to stop here, reset the room, and go right ahead. Thank you, Carolyn.
Absolutely. Wow. Great information. Thank you, Dr. Zarif. Thank you to everyone that's joined us today in the Mind of Nature. Today's topic is weird and mysterious diseases. Thank you so much for liking the live. Continue to do so. And please continue to share as well. When you share, we're bringing more people in so they can hear the conversation and be a part of what's going on in this wonderful space here with Dr. Zarif, the nutritionist. Dr. Zarif, great information.
Thank you so much, Carolyn. We're going to go ahead and start wrapping it up. But before we go, I wanted to also share with, I said sickle cell anemia earlier, and I remember sitting up in a presentation, and I wanted to really understand this better. Because sickle cell anemia, if you look all the way back to the 1950s, that's when a lot of this, a lot of discoveries of sickle cell anemia, and the sickle cell anemia was the star of the day then, back then, because this was one of the larger health concerns that we have. It's no surprise that sickle cell anemia affects African Americans far more than does white Americans. This clearly is a genetic disease that is or has little to do with the environment. Yet, even here, with a killer disease, social and political issues come into play. Now, the cause of sickle cell anemia has been known since the 1950s, but for many generations, sickle cell anemia has not had the funding, and it has not had the research attention it deserves. If you look at the time and the attention devoted to sickle cell anemia, it pales when it's compared to cystic fibrosis and other genetic diseases. Now, there are actually more Americans with sickle cell anemia than with cystic fibrosis. 65,000 to 80,000 with sickle cell anemia, and that versus 35,000 to 40,000 with cystic fibrosis. But the amount of money spent on cystic fibrosis research outstrips sickle cell anemia by multiples. And this is the shame on the medical research arm of our nation. And we continue with that until we speak up about it. It'll continue like that. It's really like if we have a certain disease or something that we know that is causing us pain, or if you're eating a certain food or drinking a certain drink or smoking a certain smoke, you are the only one that can make a decision to do healthier things for your body. To his credit, I just want to mention the National Institutes of Health is changing all of these situations that we've been talking about. One reason for this change, as research into our lung disease, our heart disease, and diabetes shows, is the growing realization that the health of Black Americans isn't a racial issue at all, but it is a human issue. So with that, I like to just go back up to any doctor or any nurse that would like to add to what we've already said, or if you have something that you would like to add to it, I would really like to hear it. But keep in mind that these rare diseases and barriers to care rare diseases are up to at least 30 million Americans now living with one or more rare disease. And that's why I thought this was really a cool topic to have over 30 million. 30, that's a lot of people. 1 million is 1,000 thousands. This is 30 million. So
wow.
That's a lot, right?
Absolutely, it is. I have here a comment from Shirley saying, I find that older patients ask less questions to doctors than our younger patients. Our younger patients are becoming more proactive and asking for more information.
Absolutely. You have to train the older person because they've been around longer. They've been, probably they've had different surgeries. Some of them are at the point where they're older, especially in the 70s and 80s, that they're like, oh, I'm not going to do that. And but a lot of them are, frankly, they're not worthy of surgery, which means that their bodies can't even take it.
Right.
So that's a good point that Shirley makes there, because younger people are now saying, what the hell is that? And they're really bold with it. And that's good. We need to ask. And then you have other people that just think that they already know. I'm the first to say that there's nobody knows everything about anything. And when we take time little by little to learn more about ourselves, we can appreciate it. So thank you for that, Nurse Cheryl Lee, Gentle Smart.
Absolutely. And I just wanted to add to that with younger patients asking more questions. I think it has a lot to do with social media as well, because you have a lot of information out there in social media, and they're like consuming a lot of things as well, always on the computer and finding out things too. So when they're going to their doctors and they're finding out, that there may be a certain um, disease or something like that they're told about, they're asking more questions about it, and they're in that research mode. I think a lot more. So I think that's where a lot of questions come into play, and then them being more proactive about, you know, those things. So that's just my take on it. I think social media has a lot to do with it as well.
Yeah, and I think that in addition to that, that we need to, especially for young folks, the ones that haven't had children yet, to have them understand the kind of impact that that can be on carrying a child. You're speaking of, your daughter, for instance, or a female in your family that is impregnated, and she now, if she's just throwing anything in her body, the world has changed. We need to definitely be on the lookout for those things, and to um, care for ourselves. There was a time that there had posters and radio commercials and other ways promoting cigarettes, and one of them was a woman, the healthy, uh, the whatever, I won't name the cigarette, but there was a cigarette that was more preferred by pregnant women. There's another poster that says the cigarette preferred by more doctors. There was another one preferred by more surgeons, and so forth. So they really worked that. I mean, people, all of the stars, everybody was on smoking, and that was the thing for them to feel that they were accepted more. It was like that edge. But if your children, your loved ones, your partners are doing these, they actually are drinking and smoking and so forth. Remember, you can offer more. You can offer, what? Did you know that, such and such? Yeah, I just wanted to share that with you, just to put it on your mind. Because I remember Carolyn told me she heard me talking to somebody about white bread and how it affected her, just
Yeah.
that. So, and I know that was white bread. Now imagine, like a cigarette, that helped her with whatever move she wanted to make with that. But, and I'm sure it was a healthier move, not, choosing that kind of bread. But this is what we need to do with our loved ones. I wanted to share this with you. A disease is defined as rare when it affects fewer than 200,000, with an estimate of 7,000 different diseases falling under the rare classification. So these diseases that we've been talking about today, there are at least 30 million Americans that are living with these diseases, and they're considered rare if there are fewer than 200,000 people with these diseases. Now, the underserved rare disease community members may face increased barriers to care and inclusion throughout and following their diagnostic odyssey. Due to systemic, linguistic, and socioeconomical challenges, diverse communities are more likely to have displays and greater chances of hospitalization from preventable conditions. It is really important that you take it in your hands. For instance, colon cancer is preventable. Colon cancer is preventable. I just had a colonoscopy, and that was one of the the sayings that I hear those professionals say that stuck with me. And it's like you can prevent it. So if you're throwing anything down here in your stomach, then you are increasing the risk of disease. If you're not eating a certain way, if you're not drinking a certain way, a lot of these things can be deleterious. Okay. All right. I think that's going to be it for today. We don't want to force this. You want to thank everybody for coming today. Every Saturday, I'm going to look at some of these notes over here before we go. Let me see here. Oh, thank you. Anthony McCulley is here. Thank you very much for being here. Chinese in Dukwe is here. Thank you very much for being here. The Hustler is here. Um, uh, very cool. And Cheryl Lee, thank you for those great questions. Thank you for being here. Watch the health namaste. Thank you is here. And we have other woo, man, we got very cool. This is wonderful. And think if you have any other questions, even after this, come back. Oh, my daughter is here. Hey, sweetie. Amira, hi. How you doing? It's great to see you here. I'm glad to see you. Always happy when you see your family in the house. Amira. So we're going to get ready to get out of here. Before you go, I wanted to remind you that there is, let me see if I can share this here. See this? These are, I'm going to open that. There we go. These are some of the herbs that I have on drzarif.com for gut health, for worms and parasites, female support, eyesight, vision, digestive enzymes, colon and restore, blood detox, blood pressure stabilizer, and allergy and fever reliever, along with arthritis relief. All of these are some of the decoctions and combinations that I have that's available for you. So I just wanted to let you know about that, because we want you to go and check it out. And I got to push more, it's about pushing those products in a lot of cases. I don't like to do it so much because I don't want to turn into a big commercial. I really appreciate you being here. Mary, you want to share anything before we get out of here? You doing anything coming up? Okay, I give her a little chance to do that. The Hustler. All right. Good. Okay, everybody. Oh, I didn't say over here. Helmet is here over on or I think I did. Yeah, I remember that name. Okay, good. I just want to make sure. All right, everybody. We want to please support those people that are taking time to share education with you. Please acknowledge what we're doing by taking action, eating and sleeping and exercising the way that we're suggesting. Make sure that you also invite other people, because we got a lot of work to do. We've been doing this for over a year now, Carolyn.
Yes, it's been, well, we started off in Clubhouse, and then we went over to, now we're here. So it's been like a year and a few months on Clubhouse, and then we rolled over to YouTube and Facebook. Hi, Amira. So yes, absolutely. We've been at it for a while, just giving this information. So yes, absolutely. When you share, comment, subscribe to the YouTube channel, that helps with Dr. Zarif. Like I said before, don't keep them a secret. Understand that the information is great. You're like, I want this for myself. No, please share the information, share the live, like the live, just let other people know about it so they can be a part of the conversation as well.
Very cool. Yeah. Thank you so much, everybody. Really appreciate you being here. And we're going to keep going. We're going to keep going. Thank you for that, Carolyn. That was great. And make sure that you subscribe. We really need your subscribe, like, leave comments. Let people know that we're here, because it's only through you that we can reach more people. So we reach out there and help them to help themselves. I'm Dr. Zarif. I'm the nutritionist, and we want to thank you from behalf of myself and Carolyn. We want to thank you for being here. We'll see you next week, next Saturday, 8 a.m., and that is PST in the house. And thank you so much. I'm Dr. Zarif, the nutritionist.